urologist who will, has to be on the same page with respect to, we watch low-risk prostate cancer and we aggressively treat intermediate to high-risk prostate cancer. So, I would recommend doing screening on men ages 55 to 69. I trained at UT Southwestern, but I spent my first 12 years in private practice in Palm Springs. Now, there's men in Palm Springs that are 80 years old that play golf better than I do, that are in better shape than I am, and their parents live to 100. I screen those guys because, it's one thing to say this is a population-based recommendation, but it's quite another thing when you have, Mr. Jones, who is the CEO of a company who, runs 3 miles a day and parents live to 100. I'm going to keep screening him until his life expectancy is kind of less than 10 years. So I think it's a very personalized decision, and I think my personal recommendation would be to get PSAs on most men that have a life expectancy over 10 years of age, and then individualize that discussion to say in advance, I'm going to get your PSA. If your PSA is low, then this is reassuring. If your PSA comes back and it's higher, let's say it's closer to 10, well, I'm getting kind of concerned here. Maybe we should send you to a urologist that can do a biopsy. You do the biopsy, that's the next agonizing decision. So you get the result back, okay? If it's a Gleason 6, we watch it. If it's a Gleason 7, and you can divide a 7 into a 3+4 or a 4+3. A 3+4, you can even watch some of those, okay? And a 4+3, I'd say 4+3 and above, we probably ought to treat that. A 3+4, then generally what I like to do is get some genetic testing. You can do Oncotype DX, but basically it's a genetic footprint. And the way these companies come up with it is they've studied thousands of men with metastatic cancer, with locally advanced with organ confined, and so there's a genetic footprint and kind of a predictive behavior analysis based on the genetics of the tumor. And so I routinely use genetic analysis too in order to figure out, well, you do have a 3+4, but it's a low volume, and you have a low risk based on the Oncotype DX score. And so I think you really have to individualize it, and agonize kind of over each point. Do we screen? Okay, we did the biopsy, now it's positive, now what's the treatment?
But at the very least, if they have a life expectancy of 10 years or more, don't be afraid to at least get a screening and make your decisions based on that going forward.
Absolutely, and who hasn't seen this, that after PSA screening was fallen into disfavor, okay, that who hasn't seen the young 55-year-old with metastatic cancer that shows up and now his PSA is 400. I mean, it's amazing moving from Palm Springs to Mount Pleasant. I've probably seen half a dozen guys between the ages of 50 to 60 with metastatic cancer, their PSA is 300. And they've never gotten a PSA before. And it was